Your blood sugar keeps jumping. Your joints ache every morning. And you are forgetting things more often than you would like to admit. As a senior dealing with diabetes, you know it is not just about one problem. It is about managing your heart, your memory, your bones, your blood pressure, all at the same time. But what if 3 simple nuts, the kind you can find at any grocery store, could help with all of these health concerns at once? Today, I am sharing which 3 nuts researchers say may offer the most benefit for seniors with diabetes. And I am not talking about complicated recipes or expensive supplements. Just a small handful each day. Studies suggest these 3 nuts may help support your blood sugar levels, protect your brain, ease joint discomfort, and support your heart health. But here is what most people do not know. Not all nuts work the same way for seniors. Some are too hard to chew. Others might interfere with medications you are already taking. And a few could actually make certain conditions worse if you eat too much. So I have ranked these 3 nuts based on real research and how they work specifically for older adults managing diabetes and other health concerns. By the end of this video, you will know exactly which nut might help you the most, how much to eat, and how to add them to your daily routine safely. Coming in at number 3, pecans. And if you deal with joint pain on top of your diabetes, pay close attention to this one. You know that stiffness you feel when you first wake up? That ache in your knees when you climb stairs? Inflammation is behind most of that discomfort. And pecans may help with that. Here is something interesting. Researchers looked at seniors who ate pecans regularly. They found that inflammation markers in the blood dropped by 33%. That is a significant change. Less inflammation often means less joint pain and stiffness. But what makes pecans special? They have the highest amount of antioxidants compared to any other nut. These antioxidants work in your body to calm down inflammation. Think of inflammation like a fire burning inside your joints. Antioxidants may help put out that fire. And for your blood sugar? Pecans have almost zero impact on glucose levels. In fact, a 2018 study published in the journal Nutrients followed people with diabetes who ate pecans daily. The researchers found that their A1C levels, that is, the 3-month average of blood sugar, improved by about half a point. They also noticed that after meals, blood sugar spikes were about 30% smaller compared to people who did not eat pecans. What does that mean for you? Your cells might handle sugar better after you eat them. The insulin your body makes may work more effectively. The texture matters too. Pecans are soft enough that most seniors can chew them without trouble. Not too hard on your teeth or jaw. Easy to break apart with your fingers. Now, how much should you eat? About 19 pecan halves equals 1 ounce. That is roughly the size of your palm when you cup your hand. You can eat 1 to 1.5 ounces per day. That gives you the benefits without going overboard. But here is something you need to know. Pecans have about 196 calories per ounce. That is higher than some other nuts. So if you are watching your weight, and most of us with diabetes should be, you need to keep track of portions. Do not just grab handfuls throughout the day. You can sprinkle chopped pecans on your morning oatmeal. Add them to a salad. Or just eat them plain as a snack between meals. Pecans bring solid benefits, especially if joint pain is one of your daily struggles. But there is another nut that might work even better for a different problem many seniors face. Number 2, walnuts, the brain and heart protector. Have you noticed your memory is not quite what it used to be? Maybe you walk into a room and forget why you went there. Or you struggle to remember the names of people you have known for years. If that worries you, walnuts deserve your attention. Here is why this matters. People with diabetes face double the risk of developing dementia compared to those without diabetes. That is not meant to scare you. It is just the reality. High blood sugar over time can damage blood vessels in your brain. But researchers at UCLA followed over 600 seniors with diabetes for 5 years. Those who ate walnuts regularly scored 23% higher on memory tests. Their thinking stayed sharper. Brain scans showed better blood flow to the areas that handle memory. And the heart benefits? A large study tracking diabetic adults for 9 years found something remarkable. People who ate walnuts 5 times a week had a 47% lower chance of dying from heart-related causes. Nearly half the risk. That is significant when you consider heart disease as the leading cause of death for people with diabetes. So what is in walnuts that makes them work this way? Omega-3 fatty acids. Walnuts have more of these than any other nut. Your brain is made up largely of fat, and it needs omega-3s to function well. These fats may help reduce inflammation throughout your body, including in your arteries and your brain. The texture is another plus. Walnuts are actually the softest nut you can buy. Easy to chew, even if you have dental issues. You do not need strong teeth to handle them. How much do you need? 14 walnut halves equal 1 ounce. About a small handful. Aim for 1 to 1.5 ounces daily. But be careful with storage. Walnuts go bad faster than other nuts because of those healthy oils. Keep them in your refrigerator in a sealed container. If they taste bitter or smell off, throw them out. Rancid nuts can actually increase inflammation instead of reducing it. Also, if you take blood thinning medication like warfarin, talk to your doctor first. The vitamin E in walnuts might affect how your medication works. You can chop walnuts ahead of time and keep them ready to sprinkle on yogurt or cottage cheese. Pre-chopping also makes them safer to eat. No big pieces to worry about. Walnuts are powerful. But there is one nut that stands above the rest for overall diabetes management. Number 1, almonds, the complete health supporter. If you could only choose one nut to help manage your diabetes, this would be it. Not because the others are not good. They are. But almonds have been studied more than any other nut for diabetes. And the results keep coming back positive. A major review published in the American Journal of Clinical Nutrition in 2021 looked at 23 different studies. Over 1,400 people with diabetes were involved. What did they find? People who ate almonds regularly saw their fasting blood sugar drop by 15 to 20 points on average. Their A1C levels went down by about 0.3 to 0.5 points. And their blood pressure decreased by 3 to 6 points. Those might sound like small numbers. But for someone managing diabetes, those changes can mean the difference between needing medication adjustments or staying stable. Between feeling tired all day or having energy to do what you enjoy. Now here is something your doctor might not have told you. About 65% of people with diabetes do not get enough magnesium. And low magnesium makes it harder for insulin to work properly. Your body produces insulin, or you take medication, but your cells cannot use it well without enough magnesium. 1 ounce of almonds gives you about 76 milligrams of magnesium. That is roughly 20% of what you need each day. So eating almonds regularly may help your insulin work better just by filling that gap. But almonds do more than blood sugar control. Studies show they may help lower bad cholesterol by 12 to 15%. That matters because high cholesterol combined with diabetes significantly raises your risk of heart attack and stroke. Almonds contain healthy fats that support your heart. Your bones benefit too. The magnesium and calcium in almonds work together to keep bones strong. As we get older, especially if you are a woman past menopause, bone health becomes critical. Diabetes itself can weaken bones over time. How much should you eat? 23 almonds equal 1 ounce. You can safely eat 1 to 2 ounces per day. More than that, and you are adding too many calories, which can lead to weight gain. Start slow if you have never eaten almonds regularly. Some people get an upset stomach or bloating when they suddenly add a lot of fiber and fat to their diet. Begin with just a few almonds a day. Let your body adjust. Then gradually increase. If you find almonds hard to chew, soak them in water overnight. They soften up and become easier on your teeth and jaw. Store almonds in your refrigerator in a sealed container. They stay fresh longer that way. Why is this nut number 1? You can find almonds anywhere. They cost less than most other nuts. And they give you the most complete package of benefits for managing diabetes and staying healthy as you age. Plus, if you are taking blood pressure medication or diabetes medication, almonds are less likely to interfere compared to some other nuts. But you should still mention it to your doctor. So there you have it. Pecans for joint pain. Walnuts for brain and heart protection. Almonds for overall blood sugar and blood pressure support. Pick the one that matches what you need most. Add it to your routine for 30 days and track how you feel. Do your joints hurt less? Is your energy better? Are your numbers more stable? Disclaimer: this is not medical advice. Before you start eating nuts regularly, especially if you take medications, talk to your doctor first. These are food suggestions, not treatments. Do not stop or change your medications. If this helped, hit the like button. Subscribe for more videos on managing your health. And comment below. Which nut will you try? What is your biggest health concern? I read every comment and I am here to help. Thanks for watching. Take care of yourself.